This is A Drugless Life. Podcast by Dr. Paul Beckham and All Seasons Full Body Chiropractic Center. Using alternative, complementary, and integrative medicine to help you live a drugless life. We get you back to doing what moves you.
All right.
And boom, we're live here. So today we are talking about what, Suri?
Today we're going to talk about KLaser and what it can do for, well, basically a lot of different things. We've got a KLaser in our office, and I know, let's talk first with the KLaser. You just recently purchased this. We are, I believe, the only office or healthcare type provider in the Fargo Moorhead area that has the KLaser brand of laser. And so what inspired you? Because you had a laser before in our office and then recently purchased the KLaser. Tell me why you wanted the KLaser.
More power. No.
Whoa.
It did have more power to it. It also had a little bit more ease of use. I mean, it had pre-programmed settings to help deal with a multitude of conditions. So instead of having to try and memorize or be constantly writing down for the staff exactly what has to be done with the laser like we did with our other one, this was already set up for, I would say, 90+% of the conditions that we have come in the office. So it's pretty much was ready to go right out of the box. And it just makes it so much easier for myself just to hand this off to staff, and for the staff to even help patients, so they can even fine-tune it themselves a little bit, whether they have a person has an acute problem, a chronic problem, whether the pain level is very minimal to very high. All those settings can be factored in with this laser, and so we can get a much more effective treatment for the patients. So
I think the first thing of business here is I think there are people out there that don't even know what is a laser or how can a laser help. Explain what a laser does, first of all.
Well, first of all, it's not a laser like you think of that maybe in a big auto factory where it's cutting up parts and stuff like that. It's nothing like that at all.
It's not going to cut your arm off.
It's not going to cut your arm off at all. There'd have to be somebody that's really, really bad at operating it, and you'd have to lay there for a really long time for that to maybe happen. So I don't think that's a possibility.
We're trained here, people. We're trained in the laser.
Now I've lost track here. What
does a laser do as far as for healing of the body?
Healing, I think the biggest thing, it really fits in, the KLaser fits in with probably 99% plus of the patients that come in the office. Because it helps deal with the big thing, inflammation. It can also help deal with muscle spasm, just stiffness in the joints and pain, and it gets down to the cellular level with the treatment. Where like we were discussing before we started talking about the show here, that it's helping to stimulate the mitochondria of the cell. If you think of a cell, you have the cell itself with a nucleus in the cell, and outside of that nucleus, inside of the cell body itself, there's 33 different mitochondrial cells which are producing energy for your cell. And what the laser does is help stimulate those to produce what is called ATP, which is the energy that your body uses to heal itself at a much, much faster pace, up to 30 times more than what naturally would be occurring there. So by utilizing the laser there, it's helping to get more energy out to your system to kind of heal things there. It's helping to increase blood flow. So if there is that inflammation there or extra water there, all that stuff is getting pulled away from the area there. By increasing blood flow as well, it's reducing a patient's stiffness. There's just multiple good benefits here of utilizing the laser, and it's all drug-free, surgery-free, and no side effects. So,
which, when we're saying it gets to the root cause of your problem, it really does. If we're going down to the cellular level here.
It's right down to the cellular level there. I can't get much further unless we're literally starting to do some DNA transplants here, which they have not gotten to the point where they can perfect that yet. So,
Right. So, typically, when you're dealing with back pain, when you're dealing with numbness and tingling, a lot of things in our office where people come in to our office, it's a result of some type of inflammation on our body. Would that be a fair statement? Some of the underlying problem is inflammation of some kind?
Inflammation is probably one of the biggest things there. I mean, obviously you can have then, the muscle tissues being involved can get tight and restricted. That can cause, restricted range of motion because of the muscles, not getting proper blood flow to them, or, literally getting fatigued and overworked because of, some people think of short-term things, but, the biggest thing that probably walks into the office are these people that have chronic things that have happened not even over just weeks or months. You're talking years. I mean, how many people sit at a desk and work at a computer and use a mouse? And how many of them end up having things like carpal tunnel syndrome happening because of just being in that bad posture? That wasn't something that was really looked at when they first developed, the mouse for the computer. Was more an ease of use. And it's something that as people have used it over time, it's, caused a repetitive stress injury. And that's something that the laser can kind of help out with, because a lot of it is then inflammation in the muscles and tendons and joints, of the wrist, and irritation on the nerves that are getting compressed, generally from the flexor tendons as they pass through the carpal tunnel there. So it's, again, some of these things we got to look at, what are the other things besides the muscle tension? It's the joint stiffness. I mean, people just get into that posture for a long period of time, and then the joints just get restricted because they're being used in ways which, it might seem normal now, but, if you look at how your body really should move, it's not moving like it should.
Mm-hmm. So basically, just kind of backtracking to see if I'm understanding this correctly. Somebody comes in with carpal tunnel or joint stiffness. The laser is going to help pump energy into the cells so it can heal itself. Is that?
It's going to help the cell itself create more energy. Yes.
Okay. Okay. So, tell me, how long are the treatments? Do they sit there for an hour, or what's
the treatments are generally rather quick. I mean, they could be, if it's a smaller area, could even be just like a couple of minutes, up to, again, multiple areas. Most areas are probably 4 to 8 minutes, and then depending on the type of condition a person has, if it's more something like a diabetic, neuralgia, or peripheral neuropathy, we're going to hit multiple areas, and then might get up to about 20 minutes or something like that of total treatment time with the laser. But then we're literally running it on probably like their lumbar spine, down the backs of their legs, and into their feet. So those do get to be a little bit more extended times. But for most people, they come in with a tennis elbow, a golfer's elbow, or something like that. Over those areas there, probably 4 minutes. It doesn't take very long at all. Okay.
What do they feel?
A lot of people feel some warmth, with the laser there. They might feel a little bit of tingling or something like that. But if the person's, the therapist or the doctor that's using it is running it over the area there, the general thing that you're going to feel is a little bit of warmth and just tingling sensation. Generally, when the therapy's done, most people are going to have some pain reduction, probably somewhere in the order of 40 to 60% pain reduction there. Okay. Typically within, if it's an acute condition, it's going to respond probably, with maybe about a half a dozen treatments. If it's more chronic, it's going to take probably more on the order of 12, maybe out to 24, really depending on how severe somebody is. If it's things like a diabetic neuralgia or peripheral neuropathy, those are going to probably even need ongoing treatment, because it's not like the diabetes is going to disappear, or the peripheral neuropathy problem is going to disappear. So they need ongoing maintenance after that, typically a couple of times a month. So,
is this something that insurance covers?
Typically not. Typically it's not something that's going to be covered by insurance. Right now they kind of call it investigational, but the results that we get with this are so fantastic. Most patients, I always tell them they're going to notice within probably the first 3 treatments that it's getting better or not getting better. I mean, I know I had a patient recently that had some issues going on with his knees and just tons of inflammation going on. And I would say after that first week, or about 3 treatments with it there, not that it was gone, but it was probably in that 40 to 60% reduction in the swelling, and that was more kind of a chronic condition too. So
wow. So after a few treatments, he was already noticing a difference.
Definitely noticing a difference, and then after I would say it's 2-3 weeks of treatments there, had just evaluated him again there, and it was probably 80 to 90% gone.
So somebody, let's say they have a chronic problem. This guy, he came in, 3 times in 1 week? Is that typical?
Typically, I mean, when you're going to come in, we're going to hit it really hard right away, even no matter whether it's a acute or chronic type problem. But, typically an acute problem, we're probably going to catch it 3 times right away, boom, 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 probably within a week period of time, and then back it off to maybe a couple of times the next week and maybe one more time the week after that, and they're probably done with about 6 visits or so. Whereas the more chronic type problems, it's probably going to be 3 times a week right away there. Might even hit them with 4 in that first week or something like that. But that's going to be about 12, fairly evenly distributed over probably 4 to 6 weeks.
So are there any adverse side effects from the laser?
There have not been any documented so far. So
okay. So it's a win-win.
Yeah. I mean, it's something where, you really shouldn't have any side effects, unlike taking even something as simple as aspirin or ibuprofen or naproxen. I mean, all those have side effects. So they're going to cause liver toxicity and all that. And, the laser is going to basically almost act like that. I mean, you're going to notice a difference fairly quickly here. And if it has been something that's been chronic, I mean, I've had people that have come in that have had, degenerative knees or even hips that have been there for even decades, and they're probably getting bad. I mean, some of them are probably getting to that point where, they might need to have a hip or a knee replacement or something like that. But, if we can kind of help them even last a little bit longer, without having to get that hip or knee replacement, especially if they're maybe a little bit younger, the longer you can kind of hold off and not have something like that done, then the longer those replacements are going to last. Hopefully the better they make them too. So.
Right. So you mentioned in the beginning here that a couple of your reasons for getting the actual KLaser is, it's got more power than a lot of the other lasers out there, so it's going to be more effective more quickly, I'm guessing. And then you said that there's a lot of different cycles, or, you've got a lot of different settings. Can you explain what some of those are? I'm guessing there's special powers that you need for special powers for like acne versus chronic pain in the back type of thing.
There's different settings as far as, again, kind of what I was explaining in the beginning there, from if a person has more acute pain, subacute kind of pain, or chronic, or I should say acute condition, subacute condition, chronic condition, and then whether they have kind of mild, moderate, or severe pain going on with it. And then that just helps dial in what's going to be used with the laser there, so it can be as effective as possible for a person. So all of that is generally adjusted by the therapist on every visit. So.
And one of the things I had brought up acne, because I think one of the settings is there is an acne setting on there. Is that?
There's some for some superficial treatment, yes, for people that have some skin kind of conditions there. I'm just trying to, I've had some patients with like herpes zoster, or shingles, what most people would think about there, and it can help reduce some of the pain associated with that. And hopefully with how the laser can kind of heat up some of that stuff. I mean, usually heat or a fever that a person would have is what's going to help kind of kill off the virus there. But a lot of times, that's just a dormant, chicken pox. So some people can have multiple episodes of it. Some people can just have it happen once. But, again, the laser typically helps to reduce that pain for them, probably 40 to 60%. Probably not going to make it disappear right away there, but hopefully it'll shorten the duration of the breakout of the herpes zoster there. So,
I noticed just having it on my, upper back and shoulder area, just from working the mouse on a computer, I just get so stiff and sore up there, and just a couple of treatments just kind of took that constant ache away. I could definitely tell that it was just that achiness that is just ever prevailing on my shoulders and neck just kind of subsided, even from, a couple treatments, which was pretty cool. So what else do they need to know? Anything
there's patients that can have, things such as like, headaches, TMJ problems like temporomandibular dysfunction. They could have sinus problems even, and the laser, because it's helping to increase the blood flow and all that, can help reduce some of that sinus pressure even. The TMJ problems, I know I've had several patients in here just recently again too, where the laser just really helps to take that edge off of the pain. A lot of them have some myofascial trigger points in some of the muscles in and around the TMJ itself, whether it be typically it's not the masseter muscle, usually it's more the pterygoid muscles, the medial and lateral pterygoid, kind of in their mouth there, that are causing more, muscular issues with their TMJ. There's a few that'll have, problems with the articular disc in there as well, but the laser just helps to kind of increase the blood flow, so it makes that tissue just much more pliable, and a lot of those people will get a lot of relief from that, because especially if it's been there maybe for a more chronic type situation, it'll help hydrate the tissue. So what's the biggest problem when people have anything as far as a degenerative joint? Most of the time is as they get older, all that tissue is basically a simple way of thinking of it. When you're younger, it's probably like a grape. It's typically about 80% water, and as you get older, if you're not using it, or it's starting to wear out, or you used it way too much, it becomes more like a raisin, so it's actually kind of dehydrating. So the laser is actually helping to kind of rehydrate that tissue. Even sometimes just a little bit can help out a lot. So
lubricating it almost.
Yep, by bringing increased blood flow and hopefully even healing up some of the tissue there. Again, like I say, I've seen knees and hips and shoulders that have been bothering people for decades, and all of a sudden we can get the vast majority of their range of motion back, and their pain is diminished significantly, if not completely reduced and removed. So
I know you've had several success stories with the KLaser in our office. Is there one that jumps out for you above all others?
Well, there's a few where we have patients coming in that have like peripheral neuropathy, where they have absolutely no sensation in their feet. I mean, we use some monofilaments to kind of test their sensation on the bottom of their feet, to the point where they can't even feel the thickest one that we have. I mean, that's pretty bad then. I mean, it's bigger than a size 2, number 2 pencil lead, and they can't even feel that when I'm touching them with it. I've seen patients with that within a couple of weeks. All of a sudden, they're feeling things down in a normal range. So those patients, like I mentioned before, with peripheral neuropathy, that's a significant difference. I mean, they can go from maybe being able to walk really well. I mean, if they couldn't feel their feet before, a lot of them end up having a really wide gait and, trying to stabilize themselves that way. And they might be bumping into things. I mean, hopefully, they're also watching their feet so they're not getting cuts on them, because if they're not having any sensation there, then maybe if they have diabetes on top of it as well, I mean, they're going to run into a lot of problems, because if they don't feel things like that, or they get blisters or cuts in there, then they're literally going to end up having issues with infections and gangrene and all that. So that would be a really, really bad result there. So
I would encourage you, if you want to do a little research on your own about the KLaser. KLaser, of course, has a website. It's K-Laser, Laser.com. But we also have a specific page on our website, and I'll share both links. Regardless of where you're listening to this, there will be some links for you. We've got a link on our website, a special page on our website just devoted directly to the KLaser as well. So feel free to check those out. Do your own little bit of research. But I would encourage you, if you've got an injury or a chronic problem that doesn't seem to be getting better from, other types of treatment that you have tried, come on into our office and try out the KLaser. It's helped a lot of people and can probably reverse some of the symptoms that you're having.
Yeah, so. And it even can be used as a kind of complementary therapy as well. So it can be used right alongside with. I have patients that come in that are on things like gabapentin for peripheral neuropathy and all that, and we can use it right alongside with that, because a lot of times over time they become kind of desensitized to the gabapentin, and that just doesn't work for them after a while. So the laser can maybe help get some of that sensation back for you. I've noted that in a lot of people with some peripheral neuropathy, they start to get that sensation back for them. If we might not get it all back, but hey, if we can get some of it back to get them closer to that normal range there where they can feel things again, they can sleep better. I mean, it just gives you a lot better quality of life. So
we supplement it with chiropractic care all the time. That's what we do here. So, all right. Well, thanks for tuning in. Until next time, this is a drugless life.
Bye.
Thanks for listening to A Drugless Life. For further information or to set up an appointment, visit our website at drpaulbeckham.com or give us a call at 701-356-0016.